cancer is an uncontrolled production and propagation of cells in our body. It can occur from any organ. Blood and bone marrow cancers constitute nearly 10 to 15% of all cancers. Over a period of last 50-60 years, lot of new developments happened in investigations, identification of biology of the cancer and treatment of cancer, and currently we can say that we are nearly reaching towards cure of cancer. In terms of investigations, in the past we were able to diagnose the presence of cancer. Now we can understand by newer technologies not only the basic diagnosis of cancer, but also at a molecular level we can detect whether there is a presence of cancer or not. There are three major steps in development of cancer treatment. First is chemotherapy. In the last 50 to 60 years, multiple types of chemotherapies through several studies are developed. Combinations of these chemotherapies have led to appropriate treatment of cancers, all types of hematological as well as solid cancers. With these chemotherapies, we can tell patients that you have reached a state of remission. So what is remission? Remission is undetectable cancer at the time after completion of treatment. However, we were never at a stage where we could tell that this cancer is never going to come back. We are reaching that slowly in patients with both blood bone marrow cancers as well as solid tumors. In the last 50 years, by understanding the biology and antigen expression of cancers, we have identified the targets for treatment. These targets focus on a particular identification of an antigen on the cancer cells and selectively targets the cancer cells. These are called targeted therapies. Combination of these targeted therapies and chemotherapies have led to a deeper response in patients with cancer. If you look at multiple myeloma, when we treat with chemotherapies, a load of disease which was there at 10 raised to 12 cancer cells in your blood and bone marrow used to come down to 10 raised to 8, where it was undetectable in blood and in the bone marrow, and we used to say there is a complete remission. However, there is significant large load of cancer still present. With the newer technologies now called minimal residual disease by next generation sequencing, for example, we can detect cancer up to 10 raised to 2 or up to 0 level. Administration of chemotherapies beyond complete remission had led to deeper responses and either longer remission or practically cure for these patients. This can be applied in majority of other cancers, both liquid cancers as well as solid tumors. There are newer therapies now. So we understand that person develops cancer because they have lost an immune response towards propagation of cancer. So if there is a new development of a cancer, our immune system tries to attack that cell. When you lose that immune response, there is a uncontrolled propagation of these cancer cells. If we can modify our existing immune system and allow a check on the cancer cells, there is a possibility that this immune system itself is going to get rid of cancer, or there is a possibility of introducing new immune system in patient's body from a person who never developed cancer, and this immune system is going to go and attack these cells. These therapies have much lesser side effects because they selectively target cancer cells compared to chemotherapies. In terms of modifications of immune system, there is a newer therapy which is evolved currently called chimeric antigen cell therapy or chimeric T cell therapy or CAR T therapy, where T cells which are part of immune system are extracted from patient's body. They are modified genetically outside in the lab and reintroduced into patient's body, where they repopulate, identify the cancer cells and kill them. This leads to complete eradication of cancer in selected number of patients. If we can introduce a newer immune system, for example, a person having acute myeloid leukemia, if this is completely not treatable by chemotherapy and immunotherapies, if we can do an allogenic bone marrow transplant where patient's bone marrow is completely removed by giving chemotherapies and a newer immune system is introduced by introduction of a new bone marrow from a donor who never had blood cancer or any form of cancer in the past, these cells are already trained to look after or treat cancer, And as we introduce these T cells in patient's body by bone marrow transplant, these cells propagate at the site where leukemia was there and get rid of this leukemia and never allow it to come back again. So, this has potentially provided cure for patients. This cellular type of therapy is now being researched and available in clinical trials for even solid tumors. So, detection of disease at a very low level by newer tests and introduction of immunological targeted therapies has revolutionized cancer treatment from a point where we used to say that undetectable cancer to a point where we can say there is a potential cure in future for cancer. If that is not possible, at least in some diseases like chronic myeloid leukemia, patients can have completely normal life with undetectable cancer by putting this active cancer in a chronic phase by targeted therapies like imatinib, where a person lives with this cancer like hypertension, blood pressure or diabetes with a completely normal life. So, we have reached a stage where we can say that from remission we are possibly going to head towards cure in cancer in few years to come. Thank you.